Okay. So, let me just pull up your chart really quickly here, okay? Okay, so it looks like the last time we did x-rays for you was actually your last visit. And they were pretty clean. No sign of any kind of cavities or changes in the dentition. How have you been doing? Okay. Do you have any concerns today about your teeth, your gums, any new sensitivities, or any areas that have been causing any discomfort? You're just nervous. I understand. Oh, these gloves have a hole in them. That pair's not going to work. Okay. It's totally natural to be nervous about going to the dentist. A lot of people are. You're not alone. But I want you to know that I'm not going to judge you, okay? Even dentists get cavities and things like that. I am just here to help get your teeth and your gums as healthy as possible, okay? And any kind of intervention we would need to do will make sure that you are completely numb. And if you have extreme anxiety, we have methods and medications that we can use to help you through that. But I'm going to be sure to let you know what I'm doing every step of the way, okay? And this should not be a painful visit. That being said, if at any point anything causes any kind of discomfort, please do not hesitate to let me know. And I will do everything I can to take steps to help and alleviate that discomfort so that this is a comfortable experience for you. It's going to be okay, I promise. I do know that a lot of people have some negative experiences at the dentist, and we do keep that in mind to make sure that we do everything we can to make sure this is a positive experience. I even have some dental trauma myself, so you're in good company, don't worry. So, real quick though, let's get you draped. I'm just going to reach behind your neck here, okay? Make sure that we have this covering. So then, a couple couple things I want to do before we start getting into your mouth is first I want to check your temporomandibular joint, okay? So I'm going to place my hands on either side of the corner of your jaw here, just like so, okay? I'm going to have you open and close your mouth. Yep, open as wide as you can. Good. And close. And again. And one more time. Okay. I didn't feel any kind of popping or clicking. Did that cause any pain or did anything feel off to you? Okay. Good. So then the next thing I'm going to do is just kind of palpate around the jaw, the upper lip, and a little bit on your neck. Just looking for any kind of inflammation or anything that might be considered abnormal. So can I just have you swallow for me? Great. One more time. All right. Good. Everything seemed nice and normal there. So, now if it's okay with you, I would like to take a look inside of your mouth. Thank you. Just need you to open for me nice and wide. Okay. So what you feel me doing right now is just those spots where I'm seeing some tartar buildup. I am just scraping that off. Because once this is solidified into tartar, you can't brush it or floss it away. Is this okay? Any discomfort? Yeah, it should just be a little bit of pressure. I'm going to go in and rinse. And close down on my vacuum. Perfect. Open. Nothing to be ashamed about. There's just a little bit of tartar buildup right by the gum line. Nothing serious. Keep opening. Okay, I'm not going to draw for just a moment. So, still doing okay? Any tenderness? Okay, good. See, I told you it's not that big of a deal. It's mostly an anxiety-making process. That being said, that's not to minimize anxiety. I just mean from a physical sense, it's not a big deal. Anxiety can be a big deal. Okay, open again. Your upper teeth now. And let's see. Someone who does have anxiety, it does help me to minimize it. But I don't want to do anything that feels dismissive to you. And now looking at the lingual side, or the back side of your teeth. Gosh, we are sure getting a lot of planes today. I know we were having some issues at SeaTac with one of the airlines. I think it was Alaska. A bunch of flights I think were canceled. I can only imagine how stressful that is. Okay. You can rest your mouth. Okay, so now I'm going to do something using a device called a VELscope, and what this does is it lets me see if there's any kind of diseased cells in the mouth. So for example, any kind of precancerous cells, it's going to make them look green. Don't let that scare you. Most of the time these are negative, and if in fact anything were to turn green, then we're going to address it right away in the most comfortable way possible for you. But let's take this one step at a time, okay? So this guy is a little bit loud. I'm going to have you open your mouth for me. Okay. Okay. Okay, well, everything was nice and healthy in there, so hopefully that lets you feel a little bit calmer about that part. Okay. And so now what I'm going to do is go back in with my instruments here, okay? And I'm going to be measuring your gum pockets, so the little pocket of gum that your teeth sit in. And I'm looking to see if there's any deep ones that might be indicative of some gum disease. So if I can have you open. Good. One, two, one, two, one, 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 two, three, two, one. Okay, now we're going to do the upper teeth. One, one, two, two, one, one, two, three. Okay. Relax. So for the most part, your gums are looking pretty healthy. There are a couple of deep pockets or deeper pockets, but nothing at this time that is a cause for alarm. We just really want you to get in there when you floss. So one of the things that I like to try and help my patients understand, because a lot of people don't really understand how to floss, is let's say this finger is the tooth and this is my floss, okay? And a lot of people just kind of go boop boop, but that's not really doing anything. So actually we're also going to have this thumb be the little triangle of your gum between the teeth. So first I like to have people kind of go up and down, rubbing against this tooth like a couple of times, and then go over the gum a little bit as well. So, and then repeat for the next tooth. So on the other side, going in between the gum, rubbing that, and rubbing that tooth. You want to do that for each tooth, okay? And the ones in the very back that don't have another tooth on the other side, you still want to go back there and rub against that tooth. And even if you can get the gum line, that also helps, alright? The first few times that might cause a little bit of bleeding if your gums aren't used to it, but your gums actually heal and recover very quickly if you're attentive and consistent. Okay? Yeah, And don't worry, at the back teeth, a lot of us have a really difficult time getting back there. That's part of our role here, is to help and take care of those teeth that get missed, and that happens for everyone, even dentists. So, like I said, not judging you at all. This is all very relatable. We are all just human. Let me just record really quickly. Okay. Now, my dear, I'm gonna go through and polish your teeth, okay? Okay. We do have a few different flavors here. We have bubblegum, mint, orange, or cinnamon. Do you have a preference? Okay. Sounds good. Alright, so you to open for me again, okay? Rinse. And close your mouth on it. Open. And now for the back sides. Close your mouth on it. Perfect. Open. Not going on the top. Close. And open. The last bit. All right, open. One last rinse here. And close. And open. And I just want to take one more look inside just to make sure that we got everything, okay? So, I'm going to have you open for me. Perfect. on like the back side here. Okay. Everything is looking good there. So I'm going to go ahead now and remove your drape, okay? Okay. And let's get this here as well. Now, just ask that you bear with me for just a moment so I can write up some notes. Okay. So everything looked good. How do you feel? Good. See, yeah, it's not a big deal. Even when there's procedures, we make sure that we get you through them as comfortably as possible to try and minimize the whole situation. But dental anxiety is still understandable, okay? So don't feel bad. You are definitely among a large group of company here. Do you have any questions for me? Okay. Well, I would like to see you back in 6 months for a routine check, and we're going to repeat your x-rays at that time, okay? Yeah, you can go ahead and schedule at the front desk. And we will also send you a reminder postcard because we know it's quite a bit in the future. And also, if you don't want to schedule today, that's totally fine too. We know that not everybody knows what their schedule will be like. Okay. It was really good to see you. You take care.